Welcome. Today I'm going to talk a little bit about heart disease and perimenopausal or postmenopausal women. This is a big issue, and there's a lot of components to it, but I'm going to share at the end a really powerful study that I heard of that I think has the ripple effect of understanding this is profound, and it's such a simple thing that can have a profound effect on heart health. So, welcome. My name is Angela Warburton. I'm an Eastern medicine practitioner by training. I have a background in pre-med, uh, but I am focused on offering very holistic, well-rounded, time-tested, but also latest scientific research that we know to help support women during this transition of menopause, which is a very powerful transition. It is a natural stage of life. A lot of women are suffering what needlessly, in the sense that we don't need to suffer. A lot of symptoms are common, but they're not normal. So I'm really here to help you understand what the symptoms mean and then give you very practical tools and tips so that you can understand what's going on and apply it at home and feel better ultimately, because this is I call it the portal of menopause. It's really a powerful stage that gets us into a very interesting time of life where we get to put into action all our wisdom, all our learning, all our experience, and step out as the most authentic, what I call radiant version of ourselves, because we know ourselves better than we ever have. And if we feel crappy, we can't do that. So I really want you to feel well, and that's why I'm here, and that's why I do this. So welcome. So let's talk about heart health. The risk of heart disease tends to increase with age. It's significantly increases post-menopause for women, and unfortunately is one of the number one issues, fatality of things causing women to die. Sorry, there was a more elegant way to say that, but that didn't come out. So it's more common now, overriding breast cancer, and it doesn't have to be this way. This has definitely increased in the last number of years. So the statistics show that 1 in 16 women over 20 have coronary heart disease, and it's the most prevalent type. So Western women often have higher degrees. Often women don't exhibit the same symptoms that we often associate with a heart attack or heart disease, where we're like thinking of the left chest and gripping our chest. Often women, it shows up as fatigue, nausea, shortness of breath, rather than the classic symptoms we associate that are more common to men. So this can lead to delayed diagnosis and often ineffective treatments. So there are lots of risk factors, high blood pressure being one, high cholesterol, diabetes, obesity, smoking. Most people know these. Very sedentary lifestyle, poor diet, definitely. Family history can play out. I think lifestyle has a bigger impact on that. Age, and what I see as the number one, and the cascade of this is huge, is stress. And so we have unprecedented levels of stress. This can come from stressing our bodies with the food that we eat, smoking, drinking, but also just poor quality food. Our body doesn't get the proper nutrients. It shuts down our gut, so we're not actually absorbing things properly. And it has a cascade of other hormones, which I'll talk about in a little bit, in another minute. But post-menopause, the risk goes up, and that's because our estrogen levels change. This is normal. We're expected to do this. Basically, when we're children, we have a flat line of hormones, and then we go through puberty, also not necessarily easy. That's where we go, and then we become menstruating women when we go through that. So we have a lot more hormones so that we can procreate if we choose to. And then menopause is a way our body says, you know what, I'm going to stop losing blood and losing energy every month, because it takes a lot of months to produce a follicle to build up a lining. And it says, I'm going to start using blood, and prioritizes longevity. So then we go back to this more flat line. We should have enough estrogen, testosterone, all the hormones should be okay if we've been living in a way that's balanced. We're in balance. But when we're not, when we're overproducing, we're overstretching ourselves, when we're pushing hard, when we're bullying ourselves to get stuff done, overriding our needs for rest, shoving too much in our schedules, then what happens is our body's prioritizing survival hormones like cortisol, and it prioritizes producing those, and it takes the energy, if you will, away from the non-essential hormones like estrogen. So Estrogen acts like a buffer. It's a real protector for heart health, keeping the blood vessels flexible, improving blood flow, maintaining healthy cholesterol levels. Estrogen can help reduce inflammation, supports just the heart muscle function, and helps prevent plaque buildup in arteries. So when we have a higher amount, it's kind of like that buffer. We have a lower risk of heart disease before we go through menopause. But post-menopause, if we've been living in a way that's out of balance, we can start to see things like high blood pressure, we can start to see plaque building up, and a lot of heart health stuff. And I think the biggest impact on this is the high cortisol, or those stress hormones, which is putting women at greater risk. So there are some things that we can do, absolutely. Stress management, big, very simple way to say that, really important. I'm going to talk about this study which actually addresses that. But there are some things that you can do that are very simple, and diet being one of them. Diet, balanced, healthy diet, eating a rainbow, eating a diversity of food, eating whole food, basically food that comes from the earth. Eating 5 to 7 servings of vegetables and fruits a day has a 70% reduction in all diseases, but that certainly affects our heart health as well. In particular, the Mediterranean diet is really helpful. And so that means minimizing processed foods, increasing anti-inflammatory, antioxidant foods. So healthy fats, fruits and vegetables, whole grains, lean proteins, nuts and seeds, fermented food for the gut. If you are struggling with your gut, I'm going to put a link in there. I just did a whole series on that. That is the root of so much of just our body's ability to break down food and absorb it. So that's huge. Fermented foods and all the diversity, really important, all really helpful. And then just avoiding those processed foods, processed meats, sugary foods, refined foods. So most people know these. In Eastern medicine, we say there are a few patterns that show up. So there's a way that we get even more nuanced and understanding how heart health is showing up. So we have different patterns. So beyond just a healthy heart or not, we look at things like if someone's got insomnia or palpitations, anxiety, night sweats, that's a certain pattern. We call it heart yin deficiency. If someone's got poor memory, more dizziness, pale complexion, palpitations as well, that can be a sign that there's a heart blood deficiency. If we've got shortness of breath with palpitations or heaviness, lack of motivation, fatigue, that's another pattern. So we get even more nuance. If we're really irritable and restless and have insomnia and a lot of redness and more of an excess, that's another pattern. Or just really depleted, it's another pattern that can affect our kidneys. That's Chinese medicine 101, not even 5 seconds of Chinese medicine. So we really want to look at your particular body and what it's showing up with, and then supporting it holistically. Just eating well, moving, exercising every day, managing stress alone will have a huge difference. But the study that I want to tell you about, this came from the University of Colorado, and they found any kind of heart-related issues, palpitation, shortness of breath, arrhythmia, so that irregular heart rate, they found that when you use breathing techniques that target the diaphragm, it can significantly improve our heart health. And the theory was that we think of the heart as a muscle, it's pumping. But what actually happens is our diaphragm, when we breathe in deeply and then we breathe out, it actually helps the heart to work. So the heart doesn't have to work as hard. It's almost like jumping on the coattails of the breath to help it pump naturally. And so when we're stressed out, or when we're breathing just in our short breaths into our upper chest, we're actually causing the heart to work harder, because we're not taking these deep breaths that engage our diaphragm. And the diaphragm, when the low belly breaths, breathing out that 360 degrees right around through our ribs, through our back, breathing like that actually takes a lot of the work out of the heart doesn't have to work as hard. And we also, when we do that, when we're breathing in that way, it's a sign that our body is not stressed. And so when we're not stressed, then we reduce our cortisol levels. When we've reduced our cortisol levels, our body has the resources to help produce the things like estrogen, to help produce testosterone, help produce healthy hormones that are considered non-essential. It also tells our digestive system and our parasympathetic nerve system that it's okay. So then we start to digest properly. So the cascade of just breathing deeply is profound. And so not only, so this is a really simple tool that you can utilize every day, breathing deeply, doing breath work. If you take a brisk walk, you're naturally going to breathe deeper. Running up and down stairs, you're going to use and utilize your lungs in that diaphragmatic breath. I think I said that wrong. Blah, blah, blah. But just breathing in that way is going to be really helpful to reducing stress levels and taking that work out of your heart. So I thought that was really interesting. If you're sitting at your desk and you're feeling like you're stressed, focus, put a little alarm on your phone or your computer. Take 10 breaths. I have a 1 minute meditation. I'll put it in the chat. Just 1 minute, and you change your breath patterns, and it's going to change your whole nervous system and remind your body that it's safe, decrease that cortisol, and get back to balance. So there you go. Little few, most hopefully something there that you can grab onto. Little things make a huge difference, and we need you to be healthy. We need your heart to be healthy, and breathing deeply can help that. So hope that was helpful. If you like this video, hit like. If you know someone that would benefit from this, please forward it on. Hit subscribe if you want little tips and tools. This one was a bit longer, but thank you for being with me till the end. But subscribe if you want more like this. And thank you for being here, and I will see you next time. Bye for now.